Hello everyone. Is it fine? Hello everyone. Welcome to the podcast by Inflame Medical Magazine. I am Rishika Chattani, the National Associate Editor at Inflame. And today we have our guest of honor, Dr. Om Lakhani. He is a consultant endocrinologist working at Zydus Hospital in Ahmedabad. His qualifications include DNB Endocrinology from Sir Gangaram Hospital in New Delhi and MD and MBBS from Maharaj Sayajirao University of Baroda. Apart from endocrinology, he has keen interest in technology and productivity. So, the topic of our discussion is endocrinology as a career option. We have a set of questions. I hope our viewers enjoy them. So, let's start with the questions, sir. Thank you for your valuable time.
Thank you so much.
So, the first question is, how does one become an endocrinologist? What is the degree needed and what are the exams that one needs to be?
Sure. That's a great question, Rishika, to start off. So, to become an endocrinologist, you will have to, after your MBBS and your internship, you will have to take up either MD in medicine or MD in pediatrics. So both medicine and pediatrics are eligible for taking up endocrinology. It's depending on your choice. Some people, most people prefer to take medicine. Some people can even, take up endocrinology after their pediatrics also. And once you complete your medicine or pediatrics, 3 years of that, then you need to further, take up either DNB or DM in endocrinology. So again, it's open for both. So, you are very well aware about the entrance exam. So, you need to give a NEET PG for your medicine and pediatrics, and then your NEET SS in endocrinology, which you need to give for your endocrinology entrance, right? And now you have, subject specific NEET exam in super specialty. So if you want to become an endocrinologist, you take up the, give the endocrinology exam. If you want to become a neurologist, you give the neurology exam and so on and so forth. So, that's the whole process. So all in all, after your internship, takes you 6 years, 3+3 to finish your endocrinology training.
Thank you, sir. Let's move to the next question. What kind of students should choose endocrinology as a career?
Yeah, so, generally people say that endocrinologist is extension of general medicine, extension of internal medicine. So, if you are the kind who likes looking at clinical signs, likes talking to patients, likes following up people for a long time. Because see, endocrinology is a subset where you deal with chronic things. A patient becomes like your family member. They are with you for a long time. Their children might be consulting you, their parents might be consulting you. Their friends, neighbors. So, if you are a kind of person if you're a people person, if you like, talking with people, if you like to, deal with them on a long run, if you like things which, have a slow momentum to it, that's where endocrinology really, it really suits you to take up endocrinology. Versus, generally, if you take something like an acute medicine, emergency medicine or cardiology, these branches, you generally deal with acute conditions. You have to take quick decisions, take decision at a spur of the moment. And then, of course, they will also, there are certain subsets where you're required to follow those patients up. But generally speaking, you would require more, thinking on your feet. Whereas endocrinology requires more of planning, more of patience, right? And if you're that kind of person who plans everything, who's patient with things, then endocrinology is the right branch for you.
Thank you, sir. So let's move to the third question. When you chose to be an endocrinologist, what inspired you the most? And what do you feel were pros and cons of it?
Yeah, so to be honest with you, like all good things in life, things often happen by accident. So I never, endocrinology was never my first love, to be very honest. I wanted to be a gastroenterologist when I was doing my MD. To that extent, that I even took up gastroenterology, after my MD. I went on to, join Asian Institute of Gastroenterology, which is one of the best, gastroenterology training institutes in India. And I spent 6 months there in my training, learn how to do an endoscopy. But that's not something which I enjoyed. That in very few first few months I realized that this is a great branch. Somebody would really love it, but it's not something for me, right? It did not suit my way of thinking, my way of doing things. So then I left that, went back to board, and then really thought deeply, what is something that I would really enjoy. I analyzed myself, and that is where it really struck me that I think it was there right in front of me. I think I was best suited to take up endocrinology, and then I did not look back. So that's how it is, and that's how a lot of people course through their life. A lot of times things happen. It might not be your first love, but it is what you really take up for the rest of your life. So I think if for young doctors who are listening to this, I think one piece of advice I really give you is that analyze yourself. See how you are, and based on that, choose your branch. A lot of people chase wrong things. They chase money, they chase fame, they chase just because my neighbor did something, I'd like to do that. The famous saying that Sharma ji ka ladka, took up cardiology, so you should take cardiology. That's not the case. There are cardiologists and there are gastroenterologists and then there are endocrinologists, right? So you might be an endocrinologist, if depending on where you think and where you work. So that's how it is, and that's how I ended up taking up endocrinology. And I honest to God, this is the best choice I made in my career so far.
Yeah, at times it is said that unplanned things work much better. Maybe this was in your case. Yeah. Let's move to the next question, sir. What is the difference between a general practitioner and an endocrinologist? And what were the major challenges you faced being an endocrinologist?
Yeah. So again, a great question. I think, a doctor in internal medicine is well trained to deal with a lot of endocrine conditions per se. And the two most common being diabetes and thyroid disorders. But the thing is that as an endocrinologist, you develop a certain mindset that is very important for any branch. So let's say you are, a airline pilot. There is a certain way you're with repeated training. There's a certain mindset you develop. You look at danger signs, you anticipate problems. Generally speaking, most times things run on autopilot. But when there is a crisis, when there is the plane is about to crash, that is where your really training kicks in, right? So the same way, compared to a general physician or a general practitioner, endocrinologist, in most cases, if you are a newly diagnosed diabetic with an HbA1c of 7.1, I think you don't need an endocrinologist. Your family physician or your internal medicine doctor will be able to deal very well. But when you are in a complex situation, for example, steroid-induced hyperglycemia, what we are seeing right now, in COVID, right? We are seeing a big mess of, poorly controlled diabetes. That is where really the expertise really kicks in. That's where you really need a specialist. And, it's never a set formula, right? I cannot give you a formula that, this is how you take insulin. So we have tried to do that, but it never works. It all comes from experience, seeing a lot of patients, dealing with them, dealing with the physiology. You understand certain things, you understand these danger signs, those things which, might go wrong. You are able to anticipate that. You're able to counter that so that your patient is able to do well for a long period of time.
So from the time you have chosen endocrinology, what are the changes you have been observing till now until you're practicing? And what could be the major reasons for this?
Yeah. So I think, endocrinology as a branch, of course, I have been, with it for a relatively shorter period of time, but I can say, speak on behalf of my seniors and my teachers, who have been in this branch for a long time. I think endocrinology has completely changed in the past, I would say decade or 2 decades. It's the face of it has completely changed. It's become a completely different branch than what it was 20 years back. So for example, let's say 2 decades back, when my a teacher, when my postgraduate teacher was doing endocrinology. That time there were no blood tests easily available. Nowadays, everybody gets a thyroid function test done. Just it doesn't even have to go to the lab. Call the lab guy at home, take the sample, you get a thyroid function test done. 20 years back, it was not that easy. Getting one thyroid test done was very expensive, time consuming. In some of the centers, you did not even have those kits and assays available. It was very, very painful experience. Same with, for example, diabetes. You look at diabetes, now you have a glucometer, you have a continuous glucose monitor. You put a CGM and you're able to check your sugar 100 times a day without any problems, right? Whereas, glucometer is a relatively recent thing. It was not there 20 years back. Whatever devices that were, they were, either in poor shape or they were very difficult to use. I still remember my own grandmother who was a diabetic. She used to take insulin 3 or 4 times a day. And she used to check her sugars using, urine sugars. That is what was perhaps, not more than 20 years back. So, the face of this entire, spectrum has changed. What is most importantly changed is that diabetes and, most endocrine conditions have become very technologically driven. Now you have new technology, you have insulin pumps, you have a lot of apps, you have devices, you have continuous glucose monitor, you have data sets, you have big data, you have EMRs, a lot of things you have now. So somebody who really enjoys technology, I think endocrinology is a great branch for that, because you deal with technology, you have to deal with technology day in, day out. When this COVID crisis started, endocrinologists were at the forefront of taking up telemedicine, right? Right now, again, even now, endocrinologists are leading the brigade for online consultations, telemedicine, and so on. So if you have to adapt to new technology, and endocrinology is the fast changing branch where, technology is something, you need to be really attached with. So that's what it has changed over a period of time. So it has become a mere, clinically dependent branch to a very data driven kind of branch. That's the biggest change you're seeing over the past few years.
Agreed, sir. So this question goes so much for, like, I think the students who would be watching would really be waiting for this question. What is the major difference between endocrinologists in India and in the Western world?
Yeah. So, I had the good opportunity of, when I was doing my residency, actually loved traveling. So, whenever I got an opportunity to attend an international conference during my residency, and I would often apply for, grants. I would, submit my papers, research papers in international conferences. So I traveled to many countries during my residency, and, immediately after that, talked to a lot of friends, made actually a lot of friends internationally, international endocrinologists across the world. There is a vast difference between how endocrinology is practiced in India versus what is practiced in the West. There's a big difference. First of all, monetary compensation wise, you'd be surprised, but endocrinologists in India do much better comparatively compared to endocrinologists in the West. In fact, endocrinology is one of the least paid branch in the United States, even less than internal medicine, which is completely different. I mean, I'm not saying that we are, doing very well off, but at the same time, we have big numbers. When I say diabetic patients, in my own building, I'll have 10 diabetic patients, at any given time. So we have, the major thing is that in India, we have big numbers. In the West, you have smaller numbers, but you have more time to deal with the patients, which is very important in endocrinology. Your patients need time, they need patience. Those things are unfortunately not possible, because when you're seeing so many patients in a day in India, there is always that, you are not able to give so much time to each of your patients. So that's the biggest difference. We are dealing with a very, very, mass number kind of situation in India, whereas in the West, they see less patients, but they see them, for a longer time. They actually, spend a lot more time with them, explaining things. I really wish that, in India, that was possible. So unfortunately, it's not. When you're starting off your practice, when you have just 1 or 2 patients a day, you can do that. But once it grows, then unfortunately, you are not able to spend so much time. So that's the biggest challenge, the biggest difference in India versus West. The second biggest difference is this true for every specialty in India versus others. In India, we are actually privileged. We don't realize this, but we are privileged. You have direct access to a super specialist with just, booking of an appointment. That's all you need to do, right? Let's say I develop diabetes, or I develop, coronary artery disease. I can directly, get treated by the top cardiologist in my city. That's the access I have. If I have a GI problem, I can directly go to the top gastroenterologist in my city. I don't need to, go through a channel. Whereas in the West, especially in the UK, right, you have a system which you have to follow. So, the first they'll send you to a family physician. He may or may not refer you to a general medicine person. He or he, may not refer you to a gastroenterologist. In fact, a lot of patients, they prefer online consultation with Indian endocrinologists because their endocrinologist, the time given to them is after 3 weeks, right? Their next appointment is after 3 weeks. That's the kind of situation, right? So, or their insurance is not covering it, or their physician is not readily, referring them to the endocrinologist. So this is what happens, right? We have access directly to a super specialist. The patients directly deal with super specialists, which is good and bad in a sense. But in the West, it goes through a proper channel. And again, that's one of the reasons why you have such a big difference in terms of number of patients also, because patients directly walk into a super specialist, whereas in the West they go through a proper signal and proper channel.
Yes, sir. But sometimes this may even be like in our country, people are not well educated, so they don't know which doctor they should choose. This goes a wrong way at times.
True, and of course that's changing now. A lot of people are aware. With Google, I think things have changed a lot. You need to kind of just Google your symptoms, and you will probably Google will show you the nearby super specialist directly. So yes, you are right in a sense that patients, there is a lack of awareness, so hence patients are not able to reach a super specialist in the sense that that's also another end of the spectrum. But at the same time, it's both ways. So but that's again an interesting difference between India versus the West. But again, having said that, there is ignorance everywhere. So what I realized in the West also, people are ignorant. So while we think that we are ignorant, we're perhaps not. People are equally ignorant everywhere. People are the same.
Okay, so let's move on to the next question. This goes on your lifestyle. How is your lifestyle being an endocrinologist? And what are the job satisfaction you have being one?
I think I'll choose the second part of the question first, the job satisfaction part. Again, young doctors listening to this, the most satisfying job in medicine, or in the entire medicine universe, is endocrinology. I'll tell you a simple reason, right? You have treatment for almost anything, right? So if you develop hypothyroidism, this is something I can give you. If you develop type 1 diabetes, there's something for it. If there's a type 2 diabetes, every single endocrine disorder has a treatment. And the treatment is extremely effective and very fruitful, right? So a patient comes literally, gasping with adrenal insufficiency. You see the patient in the emergency, you make your diagnosis, start the patient on hydrocortisone. Within 2 weeks, the patient is a completely new person, right? The patient is a changed person. We see a lot of these patients with, Sheehan syndrome, which is a pituitary disorder. These women with Sheehan syndrome, they come with listless face, almost ghost-like complexion. And when they walk in and you make a diagnosis and you start them on medications, and within few months, their husband or their children or their, neighbors or friends and all, they'll come and tell you that this person has become a completely new person. They've changed completely. They become a different person. So that is what happens, the joy you get because you are able to treat most of the conditions that you see. That's a good part about endocrinology. Compared to that, for example, something like a neurology, unfortunately, a lot of things you still cannot treat. You have ALS, right? Amyotrophic lateral sclerosis. Now I can make the diagnosis, right? But I can't treat you because not much treatment options are available. So that is what happens in other branches. Hence, endocrinology, you get the best job satisfaction. As far as the lifestyle is concerned, again, that is where endocrinologists have an advantage. My brother is a dermatologist, so I often envy him. But barring that, I think, endocrinologists generally tend to do better as far as the internal medicine super specialty is concerned. We may or may not deal with emergencies, so depending on how you want to practice, right? Some endocrinologists don't see emergencies at all. Some like to see them, so that's one. So you might not, be disturbed in the middle of your night, or you might not get a, call at the middle of the night. So generally speaking, you have a fixed hours of working. That's a good part, if you choose to do it that way. But the other issue is that there is a lot of workload in that sense, because once you start getting numbers, your old patients are still your patients. You keep getting new patients. So it's a process which keeps going on. So there are a lot of patients to see. Typically, you'll see, starting from the minute you walk in to the minute you walk out, you'll be seeing patients almost constantly. So fixed hours, pretty much workload, but again, a lot of job satisfaction. So every patient you see is a joy for you, something you enjoy, right? Patients also like talking to you. They'll always they'll always be in touch with you. They'll help you out in situations where you need them. So it's a good, generally happy, vibrant situation. And best part, in medicine, you don't see mortality in endocrinology, right? So this is what I tell. When I was doing my medicine, I was very good at intubating patients. I was, in fact, anesthetists could not intubate certain patients. They'd call me. It was that kind of situation. So that was great. But that was the last time, when I was in my third year of medicine, that was the last time I intubated patients. I haven't done that in the last, many years. No patient has died. So that kind of thing, that's a good thing, in a sense. You don't have that, pressure. So those are the pros, biggest pros of endocrinology as a specialty. But again, dermatologist is better. So if you want to take up dermatology, I think, my brother just shuts off his phone and says that, look, I'm tired now. I'm not seeing anything, right? That you can't.
But basically, you get very positive vibes when people come and thank you.
Very true. Absolutely.
Yeah. Let's move to the very last question of our session. How would you sum up your experience being a successful endocrinologist, and what are the changes you would want to see in the upcoming future?
Yeah, I think, the most important thing, and that is what has been, that's something I recognize the first day I stepped into endocrinology, even as a resident. There is a lot of, this is a point you talked about a few minutes back as well. There's a lot of ignorance, a lot of misinformation. There is a lot of, in the society per se, there are a lot of myths and misconceptions, and when you deal with a, condition like endocrinology, where you are seeing patients for a long time, these myths and these misconceptions and misinformations often creep in and create a lot of problems. For example, we talk about type 1 diabetes. Let's say you are treating a young child with type 1 diabetes for a long time. They've been on insulin. They're doing well, and then somebody reads up something on the internet, or WhatsApp post or something. Stops the insulin. The child unfortunately goes into diabetic ketoacidosis. So it's the often the problem is patients at some level, there is a lot of ignorance, and that's the biggest challenge in endocrinology as a specialty also. So what I would really like to see is people being better informed, right? There has to be, all endocrinologists and allied branches should really work towards educating the patients more. That's the most important thing. Unless we do that, your degrees, your specialty, your whatever efforts, joy, everything you get, you are not going to get, because patients at end of the day would not be educated enough to really understand what you're doing. So I think that's the biggest, what I really look for, is that we really hope that patients become more educated, they learn more, they understand more about the disease, get the right information. That's the biggest change I really like to see in the coming few years.
Yes, sir. Like internet has its advantages and disadvantages too. So that is both ways. Yeah. So it was really a fun session. At least I enjoyed a lot. I hope our viewers enjoyed too. And thank you so much for your valuable time. Thank you, sir. I hope we move on to a few more sessions in upcoming days.
So, thank you so much for having me, and great questions, Rishika, and good luck to you. Thank you.
Thank you so much, sir. Yeah, thank you. I hope our viewers could see it in on YouTube, and please like this video, and you could check out our magazine at www.inflame.com. Thank you.